for men over the age of 60. Managing fluid intakes, crucially in the evening, plays a crucial role in maintaining good prostate and urinary health. One of the simplest yet most effective changes seniors can make is to avoid consuming excess fluids 1 to 2 hours before going to sleep. This small adjustment can significantly reduce nocturnal urination, Nocturia, improve sleep quality, and lessen pressure on the prostate and bladder. As men age, the prostate gland often becomes enlarged, a condition known as benign prostatic hyperplasia. An enlarged prostate can press against the urethra and obstruct the flow of urine, making it more difficult for the bladder to empty completely. When large amounts of fluid are consumed in the evening, the kidneys continue to produce urine during the night. This, combined with incomplete bladder emptying, leads to frequent nighttime bathroom trips, disrupting rest and placing strain on the urinary system. Reducing fluid intake before bedtime helps minimize the volume of urine produced overnight. This gives the bladder a better chance of holding urine until morning and prevents the pressure that can irritate an already enlarged or sensitive prostate. It also reduces the risk of urinary urgency or leakage during the night, which is common among seniors. Sleep disruption caused by nocturia is more than just an inconvenience. Interrupted sleep has been linked to cognitive decline, reduced immune function, and poor overall health in older adults. By drinking less in the evening, seniors are more likely to enjoy deeper, more restorative sleep, something essential for physical healing, mental sharpness, and hormonal regulation. However, it's important to note that fluid intake should not be drastically reduced throughout the day. Staying well hydrated is vital for urinary tract health and helps prevent urinary tract infections, UTIs, kidney stones, and constipation. The key is to front-load hydration during the day, drinking plenty of water in the morning and early afternoon, then gradually tapering off as evening approaches. It's also important to be mindful of the types of fluids consumed before bed. Caffeinated drinks like coffee, tea, or cola and alcohol are diuretics, meaning they increase urine production and can irritate the bladder. These beverages should be limited or avoided entirely in the evening hours to reduce nocturia and bladder irritation. To implement this habit, prostate specialists recommend setting a hydration schedule. For example, drinking most of your fluids between 7 a.m. and 5 p.m., reducing intake between 5 p.m. and 7 p.m., and avoiding drinks entirely after 7 p.m. unless medically necessary. You can also urinate just before going to bed to further reduce the chances of needing to wake during the night. In summary, avoiding excess fluids 1 to 2 hours before bedtime is a practical, low-effort change that can greatly benefit prostate and bladder health in seniors. It can improve sleep, reduce nighttime discomfort, and help manage the complications of prostate enlargement, making it a vital part of any senior man's wellness routine. One of the most overlooked yet critical habits for prostate health, especially in men over 60, is responding promptly to the body's natural urge to urinate. Holding in urine for prolonged periods, especially during the evening or at night, can have harmful effects on the bladder, prostate, and overall urinary tract. For older men, particularly those with an enlarged prostate, benign prostatic hyperplasia, or BPH, ignoring the urge to urinate can significantly worsen existing urinary issues and increase the risk of complications. As men age, the prostate gland often enlarges and presses against the urethra, the narrow tube that carries urine out of the body. This added pressure makes it more difficult to completely empty the bladder. When urination is delayed, the bladder stretches and retains more urine than it comfortably should. Over time, this strain weakens the bladder muscles and reduces their ability to contract properly, further contributing to urinary retention and incomplete emptying. Delayed urination also increases the risk of urinary tract infections. UTIs. Stagnant urine sitting in the bladder provides an ideal environment for bacterial growth. This is particularly dangerous for older adults whose immune responses may already be weakened. Chronic bladder infections can lead to inflammation, discomfort, fever, and even kidney infections if left untreated. Moreover, when the bladder becomes too full due to holding in urine, pressure builds up and can backflow toward the kidneys, a situation called vesicoureteral reflux. Although rare, this condition can impair kidney function over time. For someone with a weakened urinary system, this added stress is unnecessary and potentially damaging. From a prostate health standpoint, consistently delaying urination contributes to what is known as bladder outlet obstruction. In this condition, the flow of urine is impaired due to pressure from the prostate or internal muscle tension. The longer urine is held, the more the bladder and prostate are strained, reinforcing a vicious cycle of urinary dysfunction. Additionally, the urge to urinate is an important signal from the body that should be respected. Ignoring it trains the brain and bladder to suppress this cue, which can lead to long-term problems with bladder sensitivity and control. In contrast, urinating regularly and when needed maintains a healthy rhythm between the bladder and brain. To support better urinary health and reduce nighttime problems, men should urinate before going to bed and avoid suppressing the urge while reading, watching TV, or lying in bed. It's also helpful to monitor fluid intake and ensure that the last bathroom visit is timed just before sleep. For men over 60 aiming to protect their prostate health, eliminating evening consumption of caffeine and alcohol is a powerful yet often underestimated step. Both substances have diuretic and bladder-irritating effects, which can contribute to prostate discomfort, sleep disturbances, and increased nighttime urination. Nocturia. Avoiding these in the hours leading up to bedtime can significantly reduce pressure on the urinary system and promote more restful sleep, both of which are crucial for aging men. Caffeine, found in coffee, tea, soft drinks, and chocolate, acts as a diuretic and a bladder stimulant. It increases urine production, which forces the bladder to fill more quickly. For men already dealing with an enlarged prostate or weakened bladder muscles, this results in more frequent urges to urinate, especially during the night. Caffeine also causes the bladder to contract more strongly, which can make the sensation of needing to urinate more urgent, even if the bladder isn't full. This increases the frequency of nighttime bathroom visits and disrupts deep, restorative sleep. Moreover, caffeine is a central nervous system stimulant, which can interfere with sleep onset and quality. Poor sleep not only leads to fatigue, but can also disrupt the body's hormonal balance, including testosterone production, which is vital for prostate and overall male health. In short, caffeine not only makes you pee more, but also makes it harder for your body to recover and heal during the night. Alcohol presents a different, yet equally problematic set of issues. Like caffeine, alcohol is a diuretic, which means it promotes fluid loss through increased urination. It also relaxes the muscles in the bladder and urethra, potentially making it more difficult to control urine flow and leading to nighttime leakage or urgency. Alcohol can also irritate the lining of the bladder and prostate, causing inflammation or discomfort. What's more, alcohol has a depressant effect on the nervous system, and while it might initially make a person feel drowsy, it disrupts the later stages of the sleep cycle. This leads to fragmented sleep, increased awakenings, and reduced time spent in deep, restorative sleep phases. For men with prostate issues, alcohol further compounds the problem by impairing the body's ability to manage inflammation and regulate hormones during rest. For seniors, especially those managing benign prostatic hyperplasia, BPH, or early signs of prostatitis, removing caffeine and alcohol from the evening routine can lead to fewer bathroom trips, better bladder control, and improved sleep quality. Instead, they should consider drinking water earlier in the day and switching to calming herbal teas like chamomile or peppermint in the evening, both caffeine-free and gentle on the bladder. For men over 60, recognizing the early warning signs of prostate problems is crucial, especially when it comes to nocturia, frequent nighttime urination, and a weak urine stream. These two symptoms are often dismissed as normal parts of aging, but they can be clear indicators of underlying prostate conditions, such as benign prostatic hyperplasia, BPH, prostatitis, or in more serious cases, prostate cancer. Monitoring these signs and seeking timely medical evaluation can lead to earlier intervention, better management, and improved quality of life. Nocturia, the need to wake up one or more times during the night to urinate, is one of the most common complaints among older men. While occasional nighttime urination can be caused by excess fluid intake or diuretic medications, Persistent or worsening nocturia often points to prostate-related obstruction of the bladder outlet. An enlarged prostate can press against the urethra, restricting urine flow and making it harder for the bladder to fully empty. This incomplete voiding causes the bladder to refill more quickly, especially overnight, leading to multiple awakenings and disrupted sleep. In addition to being frustrating, nocturia can contribute to sleep deprivation, mood changes, fatigue, and even increased fall risk in older adults. Studies have shown that for men over 60, especially those concerned with prostate health, the habit of sitting or lying down for extended periods without movement can have serious consequences. While it might seem harmless, prolonged inactivity, particularly in the pelvic region, can contribute to poor circulation, inflammation, and discomfort in the prostate. It also increases the risk of developing or worsening conditions like benign prostatic hyperplasia, BPH, and chronic prostatitis, inflammation of the prostate. The prostate is a small gland located just below the bladder and in front of the rectum. Because of its location deep in the pelvic region, blood flow to the prostate can easily become sluggish if a man spends too much time sitting or lying down without breaks. Reduced blood flow limits the delivery of oxygen and nutrients needed for prostate tissue repair and function. In contrast, regular movement helps stimulate circulation, clear out inflammatory substances, and promote overall prostate health. Prolonged sitting, such as working at a desk, watching TV for hours, or spending long periods in bed, places direct pressure on the perineum, the area between the scrotum and anus where the prostate is located. This can lead to discomfort and irritation of the prostate, especially in men who already have mild enlargement or chronic pelvic tension. Over time, this pressure can cause inflammation, urinary difficulties, and increased prostate sensitivity. Chronic prostatitis and pelvic pain syndrome are two common conditions in older men that are strongly linked to sedentary lifestyles. Symptoms include pelvic discomfort, painful urination, a feeling of fullness in the rectum, and pain during ejaculation. While these conditions can have multiple causes, lack of movement and pelvic pressure are key contributors. Sitting for hours without stretching or changing position exacerbates these problems, making symptoms worse and more persistent. Additionally, physical inactivity is tied to metabolic issues such as obesity, insulin resistance, and systemic inflammation, of which have been shown to negatively impact prostate health. Excess abdominal fat, for instance, increases estrogen levels and inflammatory markers that may contribute to prostate enlargement and lower urinary tract symptoms. LUTs, breaking the habit of prolonged sitting doesn't require extreme effort. Simple lifestyle changes such as standing up and stretching every 30 to 60 minutes, taking short walks throughout the day, or using a standing desk can make a meaningful difference. Gentle exercises like yoga, pelvic floor stretches, and light aerobic activities, for example, walking or cycling, are especially beneficial for increasing blood flow to the lower body and reducing pelvic pressure. In the evening before bedtime, it's also important to avoid long stretches of inactivity. Instead of lounging for hours on the couch or reclining in bed watching TV, consider getting up periodically, doing light stretches, or walking around the room. These micro movements help reset circulation and relieve pressure in the pelvic region. In summary, avoiding prolonged sitting or lying down without movement is essential for men over 60 who want to maintain healthy prostate function. Consistent, moderate activity enhances circulation, reduces pelvic tension, and helps prevent or manage prostate-related conditions. It's a small but powerful habit that supports long-term urinary comfort and overall well-being for men over 60. Developing and maintaining a consistent bedtime routine is not just about getting better sleep. It plays a pivotal role in maintaining hormonal balance, which directly influences prostate health. As men age, natural fluctuations in key hormones such as testosterone, melatonin, and cortisol can become more pronounced. Without stable sleep patterns and nighttime habits, these hormonal rhythms can be disrupted, contributing to prostate dysfunction, fatigue, immune suppression, and even the progression of benign prostatic hyperplasia, BPH. The body operates on a natural circadian rhythm, an internal 24-hour clock that regulates everything from sleep-wake cycles to hormone secretion. Going to bed and waking up at the same time every day helps reinforce this rhythm, allowing hormones to be released at optimal times. Testosterone, for example, is primarily produced during deep sleep, especially in the early hours of the night. If sleep is inconsistent or cut short, testosterone levels can decline, impacting not just sexual health, but also prostate tissue integrity, mood, and energy levels. Low testosterone is often linked to prostate enlargement and inflammation, particularly when accompanied by elevated estrogen levels, a common hormonal shift in older men. A well-maintained sleep routine supports the delicate balance between testosterone and estrogen by stabilizing endocrine function. Disrupted sleep, on the other hand, can lead to chronic stress and elevated cortisol, the stress hormone, which in turn suppresses testosterone production and promotes systemic inflammation, both of which are harmful to prostate health. A consistent bedtime routine also supports the body's production of melatonin, a hormone that regulates sleep and has powerful antioxidant and anti-inflammatory properties. Melatonin has been shown to protect prostate cells from oxidative stress and may even have anti-cancer properties. However, melatonin production is highly sensitive to light exposure and irregular sleep schedules. Staying up late, using screens before bed, or falling asleep at varying times can diminish melatonin levels and weaken its protective effects. Establishing a healthy bedtime routine begins with choosing a regular sleep and wake time even on weekends and sticking to it. Men should aim to go to bed and wake up at the same time each day to help entrain the circadian rhythm. The bedroom environment should be cool, quiet, and dark, with minimal exposure to blue light from phones, tablets, or TVs in the hour before sleep. Incorporating calming pre-sleep rituals such as light stretching, reading, or listening to soothing music can help the mind and body wind down, reducing stress and preparing for deep rest. Avoiding stimulants like caffeine and screens, along with heavy meals or alcohol close to bedtime, also helps the body transition more smoothly into restful sleep. For men over 60, eating large or heavy meals late at night can contribute significantly to prostate and bladder discomfort, especially when dealing with conditions like benign prostatic hyperplasia (BPH) or urinary tract symptoms. As the digestive system slows down with age, consuming a heavy meal in the evening can cause a chain reaction of physiological effects that place unnecessary pressure on the bladder, irritate the prostate, and disturb sleep. One of the most immediate effects of a large nighttime meal is abdominal bloating and increased intra-abdominal pressure. When the stomach is full, it expands and pushes against neighboring organs, including the bladder. For men who already experience frequent urination or incomplete bladder emptying due to an enlarged prostate, this added pressure can worsen symptoms. They may feel the urge to urinate more often during the night, even if their bladder isn't full. Because of the increased compression, heavy meals also trigger a larger digestive workload for the body, increasing blood flow to the gastrointestinal tract and stimulating various hormonal responses. This process can cause the body to produce more gas and acid, leading to discomfort and indigestion that makes it harder to sleep. Gastrointestinal bloating, particularly from high-fat or high-sodium foods, can further irritate the bladder and surrounding tissues. Late night eating can also impact the body's insulin response and fluid retention, especially in meals rich in sugar and salt. Sodium causes the body to retain fluids during the day, which are then mobilized at night when you lie down. This results in nocturnal diuresis, a phenomenon where more urine is produced at night, increasing the number of trips to the bathroom and disturbing sleep. In men with a weakened urinary system, this places extra stress on the bladder and prostate. Another concern is that late meals often lead to acid reflux, especially if a man lies down soon after eating. Acid reflux can irritate the diaphragm and nerves that connect to the lower urinary tract, indirectly worsening urinary urgency or frequency. Additionally, discomfort from reflux or bloating can lead to poor quality sleep, which over time disrupts hormonal balance and weakens the body's ability to regulate inflammation, both of which affect the prostate. To prevent these issues, it's recommended that men finish their last meal at least 2.5 to 3 hours before bedtime. Evening meals should be light, easy to digest, and low in sodium and saturated fat. Ideal options might include lean proteins, steamed vegetables, whole grains, or a small bowl of soup. Avoiding spicy foods, caffeine, and alcohol during dinner is also important to reduce bladder and digestive irritation. In summary, limiting heavy meals late at night is a critical strategy for protecting the prostate and improving urinary comfort in older men. By reducing abdominal and bladder pressure, supporting restful sleep, and avoiding unnecessary inflammation, this simple change can lead to significant improvements in nighttime well-being, digestion, and long-term prostate health. For men over 60, struggling with poor sleep is a common issue, especially when dealing with nocturia, frequent nighttime urination caused by prostate enlargement. In many cases, older adults may turn to sleep medications, either prescription drugs like benzodiazepines or over-the-counter OTC. Sleep aids containing diphenhydramine or doxylamine to find relief. However, using these medications without consulting a doctor can actually worsen prostate-related urinary problems.